So just a little bit of the anatomy of the body before we begin with the exercises. So for most people, they're always sitting at a desk and they're always at a 90 degree with their pelvis. And so what happens is that some of the muscles will get really, really strong or tight, and then some of the muscles will become very, very weak and will not be contracting when they're supposed to be contracting, and so something else has to take over. For example, like the hamstrings, those are the number one muscles that are stretched out. They're strong, but however, they're weak. They actually are pulling too much on your pelvis because the muscles in the front of the pelvis, the hip flexors, they're too strong, so they're pushing the pelvis forward too much. So then the hamstrings have to elongate too much because you don't want to fall over. So then what happens is that now the back has to extend a little bit more, and then that's where the lower back pain comes into effect because their glutes also are not doing their work. So I'm going to show you some exercises for the glutes and then some exercises for the abdominals. So I'm going to give you a couple of options, so it depends on your ability. So some people cannot bend properly, or their balance are not very good. So I'll give you some beginner exercises and some intermediate and then a little bit more advanced. Okay, so just choose which one that you prefer. And however, if there is any pain that is created with it, you're going to have a little bit of discomfort. But if there's a lot of pain, please don't do them. Alright, so this one is the simplest to do. So you can actually do it on your bed or on the floor if you choose to. So the thing to remember though is that it could be difficult for some people at the beginning, and you actually may have some referral pain going down. So if you already have sciatic nerve, I would suggest not to do it when you're actually in an acute situation, when you're really in a lot of pain. This would probably be best to do when you're actually in a chronic situation, or even to try to prevent the pain to begin in the first place. So with this, the glute, you're going to really feel it onto the side of the hip. So sometimes you can actually feel going down, like the pain may go down to the leg while you're actually doing this. But if it's something that is really, really painful, do not do it. So this is just, you may feel it, it's just because you're contracting the muscle, and sometimes it is just a trigger point that is being released. So just try to evaluate on your pain tolerance, on how much you can tolerate, and it'll get better. All right, so you just want to put your hand onto your glute, and then you want to put your knees at a 90 degree, and you want to bring your knee and your foot to the ceiling. As high as you can. You're going to feel contracted right there. Sometimes you may not even feel contraction right here because you haven't used your glutes for a very long time. So they may be really, really weak. So what happens is that some other muscles will try to take over. So just make sure, because you have to reconnect your muscle memory with your brain. So make sure to put your hand onto your glute and just try to really concentrate on the glute, and then it will come with time. So you just kind of try to bring up your knee and your foot to the ceiling. So the goal is here to do about 30 on each side. So you may not go to 30 right from the beginning. So you may want to do just 5 at the beginning, then in a couple of days and at 10. And then you increase to up to 30. Okay, so this next one is a little bit more difficult. You can still do it on your bed or on the floor. Sometimes on the bed it may be a little bit too soft, and you won't get as much of a workout. So the goal here is to contract both glutes at the same time. You may feel like one of them is actually stronger than the other, but that's normal. So you just try to concentrate on both of them being contracting at the same time. So what we're going to do is you put both feet onto the surface and make sure that your knees are parallel to each other. Sometimes they may want to wing out a little bit, so try to really concentrate on having your knees together. And then you're going to bring your hips up to the ceiling. So at this point, most people, this is what they're all like going to do, but you're not really concentrating on the glutes. Sometimes your hamstrings are actually going to take over too much. So we want to reinforce the glutes. So what we're going to do is you bring your hips up even more. So you're contracting your glutes. So if I'm releasing my glutes, and then I'm bringing my glutes up, I'm contracting. Releasing and contracting. So you want to contract your glutes. You can actually feel them, how hard they're going to be when they're actually contracted. So you may want to just stay up here for a couple of seconds, maybe 30 seconds, or you want to pulsate. So this next one is the squat. So I know a lot of people have a hard time with their knees. So you just do the best that you can if you choose to do this one, okay? So you want to bring your feet at your shoulder length and point your toes outwards a little bit. But make sure that your feet are aligned. Sometimes like even your pelvis can like twist over a little bit. Just try to make sure that your hips and your toes are equal, and your shoulders also. So our goal is to just bring your pelvis out and make sure that your knees are not going forward past your toes. So you just bring your pelvis back and your knees down, okay? And then when you come up, you're going to use your heels and your glutes to come up. So squeeze, 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 and don't stop here. You got to squeeze even more, okay, to bring out your pelvis, because that's when you're going to use your glutes. Okay, so again, we're just going to go back and then go down and then squeeze your glutes completely and then go forward a little bit more, and then you can hold it there if you want to for a couple seconds, and then release and come back up and use your heels and your glutes. Okay, so let's try to do it on the side here. Okay, squeeze, and you want to contract. So this is going to be really, really tight, but that's what you want. So this one is my personal favorite one, and however, it could be a little bit difficult for some people because it does require some balance. All right, so you're gonna hold onto a wall, and the side that you're holding on is the leg that you're going to be bringing up at a 90 degree. And this is the side, the other side is the one that's going to be contracting. So your goal is to just relax your hip, just like a lazy position here. And then you're going to contract your glute, and you're going to bring it up to, it's like almost like you're doing, you're trying to bring the other side of your hip to the ceiling. Okay, and you contract, you can relax, and then you contract. You relax, and you contract. So it's going to be difficult at the beginning, okay? And you're going to really feel it into the glute. You may even like start shaking, okay? So sometimes you can have one side that's actually weaker than the other, so which is normal. So again, up to the wall, the leg that's 90 degree will be on the same side, and you're going to relax that hip and bring it up. And your goal is to get up to 30. So for the ab workout, this exercise, it could be done on your bed again or on the floor. And you're just going to lay down. And you're going to bring your feet up to the ceiling. And the goal is to contract with your abdominals. So you're going to bring your hips up. So you don't want to swing your legs. You just want to contract and try to touch the ceiling with your feet. So another ab exercise that's very good is the plank. So the best way of doing it, you can do it on your knees or you can do it on your toes. So you go onto your elbows, okay, and then you're going to contract and try to contract your glutes and your abdominals at the same time. Okay, and you hold it. You can hold it for 30 seconds or more. So you may feel like you're shaking at the beginning also, and that's good because you're actually using the stabilizers that are in your core and also in your glutes. So this next ab exercise is very easy to do. It's called the boat. So what you want to do is bring your legs up into the air. You can straighten them out, but I find that it's a little bit easier at the beginning to have them kind of a 90 degree into the air. And then you want to bring out your hands and make sure that your shoulders are back and your spine is straight, and you just hold it there. So if you have it higher, then it's a little bit harder. If you do it at a 90 degree, it's a little bit easier. So you just try to hold it there as long as you can for about 30 seconds. So now I've given you some excellent exercises for your abdominals and also for your glutes, but now we cannot forget to stretch our hip flexors. So the best way of doing it is, well, the easiest way is actually on a chair. So you go onto the side of the chair and just half of your pelvis goes and would be supported, and then the other one is kind of like hanging off of the chair. So that leg, you just bring it back. So this one is a 90 degree, but this one is in the back. And you just straighten out your knee, and you can bring that hand over. So you're really, really stretching all of that in the front. You may even feel it in your knee sometimes because your quad is also going to be stretched out. So you just bring it back. And you can do a little bit of an extension with your back. Just bring your hand out back. So you want to hold that stretch for about 30 seconds. So you just do the other side. You just turn over. And now if you want it a little bit more difficult, a better stretch, then you just do it without the chair. And just make sure that your foot is really forward so then your knee doesn't go like past your toes. Okay, so just make sure you have a very wide stand and the knee is locked in the back, and then you do the same.